From the care coordination standpoint, I know we are discussing the issues, why they would be, um, why it's needed to have someone. But I don't talk to the patients as much as you do, obviously. So um, this challenge that they are, when they start a program, they go through this fear in some cases. Many of their friends are saying, "Oh my God, you are going to get your stomach taken out." Well, but my BMI is 55, so they're not freaking out on that, but they're freaking out on the solution. So the care coordinators are doing a really fantastic job to not only follow up with them, but keep the process as smooth as possible. But uh, how is the feedback that you get from the patients, and why, in your opinion, why this is so important for the program?
Absolutely. So that is a question I ask every patient that is going through the process when I meet them, either for a follow-up in the office or when I'm doing endoscopy, for instance, as part of the preparation. When I meet them in the preparation area just before the endoscopy, I go over the procedure and then I say, hey, how is the rest of the process going? And almost always I get a positive feedback, Kemal, because they tell me that their bariatric coordinator has been really very diligent in helping them through the process. And why is that help so well recognized by the patient? Well, because the process can be very cumbersome if a patient is left by, to their own, on their own means to navigate it, right? Because it requires appointments with different specialists. So just imagine if I, as a surgeon, prescribed all those needed requirements to patients and I tell them, okay, fulfill all that and come back and see me in 3 months' time, right? It would be very difficult for patients to do that by themselves. And the reason is because each appointment that they have to undertake may result in further appointments and further tests, right? And getting the results of those and understanding the necessity of following up with a particular test requires somebody with some knowledge, somebody that is doing it day in and day out. Just by themselves, the patients will have great difficulty, and very often they may even give up in the process if they are not guided. So for them to have a coordinator assigned to them that will be reaching out to them at various intervals through the process to make sure they are getting the right information, to make sure they are following up on the consultations or on the tests that they have been assigned is very important, right? Now, this makes not only the process a lot easier for the patients, but it makes their buying into the actual process a lot better as well. Because come on, if you go into something that you don't understand very well, you just know that it is necessary, but you don't understand very well, and then you find obstacles in the process, your mindset may not be positive as you get into it, right? And that positive and that happy relationship with it is important when it comes to the outcomes later on as well, right? It has an impact. How was your experience through the process? A person who says it was great and a person who is not so happy about the process may have different outcomes in the long run, if you think about it. So really, this is very important, not only in facilitating the actual physical process for our patients, but maybe even in having an impact in the outcome in the long term.